Hi Tina, my name's Ashley. I'm going to be your nurse today.
Hi.
How are we feeling?
I'm okay. I've been better.
Tell me what's going on.
The last couple of days I've been really itchy and it's been stinging down there. I don't know what's going on.
Okay. Is it painful at all?
Yes, it hurts so much.
Oh, on a scale of 1 to 10, tell me your pain. 1 being the least painful and 10 being the most.
I would say about an 8.
What's the pain like?
It just feels like pins and needles and it just won't stop.
Okay. Well, I'm going to go ahead and give you an exam. We're going to take a look, see what's going on down there, okay?
Okay.
So go ahead and prop your feet up here for me. Perfect. Okay.
This hurts so much and there's nothing I can do to relieve the pain.
Have you tried any remedies at home?
I've tried like Tylenol, ibuprofen, and even Benadryl because I was having an allergic reaction, but nothing seems to help, and I feel like it's getting worse, and I try to look down there, but my belly's in the way.
Understandable. How about baby? Has baby still been moving?
Yep.
Notice any changes with baby?
Nope.
Okay. Take a look here. Okay. Well, I'm noticing some lesions.
What does that mean?
It could mean a few things. You can go ahead and put your legs back down. Have you recently been sexually active?
Like a week ago.
Okay. And, there we go. Have you, had any new partners recently?
Nope, I've just been with my boyfriend the whole time.
Okay. And how often are you two sexually active together?
Besides last week, I think it's been like 4 months.
Okay.
Because I just feel so gross.
Okay. Have you been having any other symptoms besides the pain and the itching and the tingling?
Mm-mm.
Okay.
No.
Well, what I'm going to do is I am going to talk to the doctor about what you're experiencing. We might need to run a few tests, just depending on what he says.
Okay.
But I'm going to go speak with him, and I'll be right back with you, okay?
Okay.
So just sit tight.
All right. Come in.
Hey, Tina, still doing okay?
Yeah, I'm okay.
Okay. So I had a chance to speak with your doctor.
Okay.
I explained to him the signs and symptoms that you're experiencing, as well as the lesions that you've got going on, and he suspects that you may have contracted genital herpes.
What?
Not to fear, I'm going to explain. Have you ever experienced a sexually transmitted infection before?
No, never.
Okay. So what he has ordered, he's ordered a test called the Western blot test.
What's that?
It's basically, I'm just going to swab one of your cultures with this right here.
Okay.
And we're going to run it in the lab. It'll take about a week to get the results back, but that'll confirm or deny the diagnosis
Okay.
of herpes. So I'm going to go ahead and do that now.
So, okay.
Go ahead and prop your legs back up here for me. Do you have any questions for me right now?
So, what does that mean for my baby? Does that mean my baby has herpes too?
Not necessarily. So, if the test comes back positive, because you are already 34 weeks along, we'll have to go ahead and schedule a C-section. You will not be able to deliver vaginally just because of the increased risk of transmission to your baby at the time of delivery, regardless if your lesions are active at the time of delivery or not.
That makes me so sad because I just wanted to have a vaginal delivery.
I know, but if this test comes back positive, it's at the best interest for your baby and your baby's health for you to have a C-section, because if you do have active genital herpes, if the test comes back positive, if you were to deliver vaginally, since you contracted it so far along in your pregnancy, your baby has an increased risk of contracting it regardless if your lesions are active or not. Does that make sense? No need to fear, no need to worry. Go ahead and spread your legs apart a little farther.
This is so embarrassing.
There's no need to be embarrassed.
I'm sorry, I'm crying.
No, it's okay. Okay? Just a little tingle or a little cold. Okay.
Are you done?
I am finished.
Okay.
Okay, you can go ahead and sit up for me. Hey Tina, I'm back.
Hi, I'm done going to the bathroom.
Perfect. Okay. Now we can get to those questions
Okay.
that you had for me.
Okay, so what do I have to know? Like, what do I have to know about my baby?
As far as so for your baby, there's nothing different that you'll need to do if the tests come back positive. After your baby is born, we will monitor for signs and symptoms of active herpes in your baby, such as blisters anywhere on the skin, a fever, increased tiredness, increased irritability, decreased appetite. Now the thing with these symptoms is they may take up to 14 days to appear. So if your baby seems healthy after he's born, he'll go ahead and get sent home with you, but it'll be up to you to monitor for those symptoms. And if any of those symptoms arise, you'll have to bring him back to the hospital immediately so we can run further tests.
Okay. Is there anything I need to not do?
Some things to avoid at home, especially if you have active lesions, is avoid inserting anything into your vagina. So no douching, try to avoid hot baths, anything like that. Avoid sexual activity. So inserting anything into your vagina or irritating your vagina.
Okay.
If that makes sense.
Okay.
Okay.
Makes sense.
Now, if your baby were to experience any of those signs or symptoms, some of the tests that we would have to run would be a stool or urine sample for culture. We may also have to do a lumbar puncture and obtain spinal fluid to test that. If any of those tests come back positive for active herpes, then we will start your baby on a 28-day treatment of acyclovir.
Do I have to go to the hospital for that?
No. So if your baby needs that 28-day treatment, he will have to stay in the hospital because it is administered through an IV, but you will not have to be admitted to the hospital for that length of stay.
So what happens if my baby doesn't get the acyclovir?
So if your baby shows signs and symptoms and he is not brought to the hospital and the herpes virus is not caught and treated effectively, then that could lead to mental retardation. It could lead to other cerebral problems. So it's very, very, very important that if the baby does go home with you, that you monitor him closely for those signs and symptoms and bring him, that we discussed, and bring him back if any of those come up.
Okay.
Does that make sense?
Yes.
Okay. So, take a look here. Everything looks great on the monitor. Baby's heart rate is perfect within the normal range.
Okay.
Looks like about 130 to 140 is what I'm seeing. So that's great. So again, just that you're at that increased risk for infection like we talked about.
Okay.
So again, with the nothing vaginally, just continue with your daily iron and your prenatals. Also, since this is new to you, you're at kind of a deficient knowledge on the disease process. We have a couple pamphlets here, just with some further information. If you have any other questions or if any problems arise, you know how to contact us. You can call us anytime, and we'll always be here to answer your questions.
Okay.
Do you need anything else from me while you're here today?
I think that's it. Thank you. Thanks so much.
You're welcome.
Banging the drum like dum dee dee day. I know you want it in the